So I guess the basic rule of thumb for car transfers with people is to maximize safety getting in and out, and every individual has different needs, right? So in general, in getting in a vehicle, going buttocks first, right? Reaching back for the frame of the door to lower yourself in. And then from there, if they need assistance, you know, they can help with their legs individually, going one at a time. Getting out would be similar. So I'd go leg. Now, some people do the wrong thing by reaching and pulling. To make it the safest approach, you'd want to kind of push from whatever you're sitting from or grab the frame, okay? Sometimes, depending on the need of the person and the height of the vehicle, there's a gadget called a car cane where you can insert it into the hook of the door. So if they can't push and they have a shoulder problem or, you know, whatnot, this is another gadget that's available. So you can kind of push from here and assist to standing. Okay, so the biggest thing with this is you have to make sure it's in all the way. You know, it's always helpful. And then just slowly lowering. They're compatible with most vehicles. All have a hook, you know. They're about $20 or so on the internet. You can buy them. They're just called a car cane. And they're also helpful. You can keep it in the side dash if you're, you know, going over a bridge or, God forbid, you're in, you know, underwater. You could use it to smash the windshield or the window. So that's simple for that. With a cane, you know, you could always bring the cane over. They could assist the cane by putting it near the vehicle. You never want to, you know, push yourself up. You want to make sure that you're steady. You're pushing from the frame or the car cane up to standing, and then you have the cane. Because when you're getting out of the vehicle, it's going to be the first couple of steps where you're most at risk. So getting yourself steady, I usually encourage people to kind of bend their knees a little bit, make sure their knees are with them before they kind of go to step and walk. For a walker, same approach. So you're going to push from whatever, you know, the frame, the seat, upright, then you grab hold of the walker. Same thing will apply when you're, you know, standing from a seated position off a couch, a chair. You never want to pull and the walker can move. So it's there for stability, but it's not secure to the floor. Does anyone have any questions about that? I think the biggest thing is just kind of going in buttocks first, you know, because sometimes people have a hard time with their balance going one leg in. That's not so helpful. If someone had a hip done, again, you have to make sure that the seat is high enough for a posterior hip replacement. But again, you could always, if you're unsure, you could put a cushion in the seat.
I have a question.
Sure.
So quite often, a lot of us drive SUVs. It's the Northeast, and a lot of times people who have had knee or hip replacements or severe arthritis can't get into our higher vehicles, and they want to use a step stool. What would you do in that situation?
So I think if someone is behind, so if the caregiver is behind the step stool and the person, you're getting yourself as close to that person as possible. And then if they're coming down from it, you would be in front of them. Similar to a stair scenario. So if you're guarding someone on stairs, they're going up the stairs, you're going to be behind them. Coming down the stairs, you're going to be in front of them.
So, but if they're stepping into a higher vehicle on the step stool.
Yep. I would position the step stool as close as possible.
They're going to go in forward?
Well, they're going to kind of turn. So you're going to still try to do buttocks first. So you could have the step stool.
Yep.
They can kind of have a step. Again, I would try to do is position yourself. You're kind of kitty cornering yourself to the car and the stool so that if something was to happen, you're going to have a place to secure them. And if you have any hesitation, there's things called gate belts that you can put around people's waists. They come in nylon, so you can wipe them down in between people. That way you're not going to grab the worst thing you can see is people grab shoulders and then they, you know, hurt their back. Grabbing someone's belt line is probably the best thing, or coming underneath their shoulder and wrapping yourself close to someone. Yeah. So again, it would kind of depend on the circumstance for how I would navigate the stool up and down.
But basically, they would still hang on to the frame.
So they could hang on to the frame.
But they're going to be backwards on the step.
Yep. So you're going to kind of step up onto the step, right? And then you're going to be right assisting them.
Yep.
You're still going to kind of step up onto it, and then you're going to go buttocks first. Is how I would propose it. Or if they have a step on a truck, a vehicle,
right.
You know, they'd be in front of you, you'd be behind them, they'd have the frame, you'd step up and then try to get yourself into it.
Yep.
And again, I think it's a case-by-case basis. Right. You know, you have to kind of keep yourself close to the person.
Right.
right.
If you're having any hesitation, yeah.
Seniors helping seniors. So
Yeah.
we do have limitations ourselves.
Sure, and keeping yourself close and not bending over. You know, that's another thing. If someone's in front of you and you're in front of them, kicking one leg behind you is going to help you. If you have to reach overhead or reach in your trunk, one leg back helps a ton. And sometimes that position can be challenging to balance. So you have to make sure that you're safe first, because if you're putting yourself at risk, that's not going to help the other person, you know. Yeah.
Could you show that tool one more time for
Sure.
folks that weren't over here to
Sure.
see it? 'Cause that's pretty neat.
So a car cane. So let's say I'm having a hard time getting up out of the vehicle. I can apply pressure here. I could apply pressure, you know, to the frame, something that's secure, lower, not pulling to anything, and then pushing up. And then I would take it out.
Thank you.
You're welcome.
What's that called?
It's called a car cane.
Car,
Car, C-A-R, cane. 2 words.
car cane?
Car cane, like a cane.
Oh, yeah. Even though car cane.
Yeah.
Okay.
And so Sarah, just one of the things that I want to point out too, that you kept using the word stability. So you want to have them grab onto something that's stable.
Always.
Not the door.
Not the door. The door
A lot
moves.
of
It
times
flings
they'll
out.
Reach for the door, and of course the door is moving.
Exactly.
You know,
The
that can
frame
move,
is ideal. You know, the dash isn't going to go anywhere.
Okay.
It kind of depends, you know, keeping yourself close, ideally the seat surface. But again, this is a little bit, you know, the seat's not going to go anywhere. The frame is most secure.
Yeah.
But again, if you have a problem with your left arm and you're getting out of the vehicle, you know, that's kind of limiting. So you kind of have to do what's available. And I think, you know, talking it out, if you have someone that you don't know how, Shay, how's your shoulder movement? Can you lift your arms? Can you move your legs? Do you have any pain? You know, I mean, people if they have insecurities, you have to ask them ahead of time. That will help you prepare to know, when was the last time you got out of the car? You know, or do you have trouble with this?
Yeah, those are all really great points, because I'm the companion program coordinator.
Yep.
It's my responsibility to make sure that my volunteers are transporting people that can ambulate from the house to the car
Yes.
into the offices. So those are really important clues for me to say.
You know, if I can't lift my arm, you know, that's helpful to know. Can I move it a certain manner to the
Yeah.
side? You know.
Yeah.
And also, I think the other question that you kind of implied, Sarah, was, you know, have you ever gotten in and out of a SUV before? You know, if they're used to getting in and out of a car that's low to the ground, or the opposite, they're used
Yep.
to getting in and out of a higher vehicle.
Yep.
Yeah, I think I wouldn't have necessarily thought about those questions, but I think
Yeah.
that's really helpful to know.
And you can move the seat forward or backwards. So an SUV is actually easier because it's higher up, right? But a lot of people I
Generally.
see have, you know, older vehicles, they can't get out. How can I get out easier? That's where the car cane could come into play.
Yeah.
Or if you get a cushion, you know, that raises the seat a little bit ideally, but,
Yeah. Yep.
you know, more and more.
I used to transport a heavier woman, and she told me use a garbage bag, and I always have a garbage bag with me.
Oh, really?
I
Just slip
put it on
to
the
underneath
seat.
to slide?
She could always slide her legs around.
Well, that's another good point. So scooting to the edge, right? So whenever you stand up from a seated position, and this is, you know, I'm pretty tall, so I make it look like easy, but for someone that is shorter, if they're stuck in the back, I can't get out. So I would want to weight shift. If they have trouble shifting their mobility to the edge, you could kind of encourage them, grab the steering wheel, kind of shimmy a little bit, and then grab the seat and kind of shimmy, almost like you're working your buttocks to the edge of the seat until your feet are on the ground.
And you can do that with a garbage bag.
You can. That will give you a little bit more help. Yes, that's very true. But even just getting out of the chair, if someone's been sitting watching television for a little while and they can't get up, how can they maneuver? Sometimes just encouraging people to move their hips side to side, or just, you know, weight shift a little bit, that can get the legs going. You don't want to stand up if your feet are hanging in the wind. You have to have stability on the ground first. So that's always a first step that I kind of forgot to talk about a little bit. But
I have another question. So when you have a client that comes in for physical therapy,
yeah.
do you go over this with them and the family?
So it's like a case-by-case basis. When I meet with people, I kind of talk about where their problems are and what their needs are. And sometimes when I have people coming in for specific things, I often will be in the waiting room. So I kind of like watch them come in and I see how things go. So yes, it's often I take people into the parking lot and encounter that just to give them tips.
Yeah, it's just a good point. You know, as a caregiver, I would never have thought to ask the physical therapist, can you show me how to get my mom in and out of the car?
Yeah. Well, it's simple even for like standing. If they're having trouble standing, often they're going to need some help getting out of the vehicle. And a lot of the times I ask people, hey, are you going out of the house? Are you staying home? I mean, sometimes these are things we don't really think about, but ultimately, if they're coming to therapy, they're going to be getting out of the house, coming in, and I want to make sure they're not going to have a fall in the parking lot or at home, you know. So, any other questions? I mean, another just body mechanics tip. Say you're getting something out of the back seat, you're reaching, like I said before, rather than reaching like this, it's something we do a lot. And until we have an injury, we say, oh, we can't do it that way. So if you reach for something, kicking one leg back, securing yourself on the platform and then going. You don't have to pick your foot up, but just kind of staggering your stance, bending your knees, one foot in front of the other. That is a tremendous back saver for a lot of things. Even just getting groceries out of the back seat, you know, it doesn't matter how old we are, we can all sustain an injury doing something like that. Twisting, we don't want to twist with our feet planted, we want to move our feet as a unit. So, okay, yeah, so.
Okay, are we ready to take this inside?
Sounds like a plan.
Okay, we're gonna go upstairs.
Perfect.
I just felt it buzz here, so I think it's okay. So my name is Sarah Brown. I'm a physical therapist from Core Therapy of Holyoke Medical Center, and I've been asked here to speak about some tips and tricks to prevent falls in the home. So I provided with you today a home safety checklist, which I think is really helpful. What I would recommend doing whenever you're walking into someone's home for the first time is just try to be really mindful of what is around you on the floor. What is like the first thing you see? So looking for clear staircases. Sometimes people put things on the stairs near the railings, throw rugs, carpets, sometimes even like plug outlets, wires, cords, toys, lots of things in different places. Sometimes assessing for railings, if railings are old or if they're loose, because people sometimes don't maintain their homes. Steps are uneven, sometimes thresholds are unsecure. Different grades for the height of the steps. So if you have someone that you're taking in and out of the home and they haven't been out for a while, really looking at, asking them, when was the last time you did stairs? I mean, hopefully it's soon, but if it hasn't been soon, that's something you want to know, and that's going to help you identify their mobility. If you have them sit in a chair with you, you can ask them, how high can you lift your legs? Do you have any trouble with your knees, your ankle, your feet? Moving around, it's going to give you a gauge of what is going on with them. If they have any pain, if they have any concerns for anything about getting out. I would encourage you, if you're going down the stairs with someone, you want to be in front of them. And always, if you were to use, say they have a railing, you always want to encourage railing use whenever accessible. So if someone has a railing and you're in front of them, you want to kind of be close enough if something was to happen where you could kind of, essentially not push them up against the wall, but a rail, and then you could hopefully call for help, versus if you're far away, and they go down, you could hopefully prevent a fall with your knee or something like that if you're close to them. That's how we're trained in therapy school, to really keep yourself close, and using a safety belt, a gait belt if you needed. That could be another helpful thing, I think, as caregivers to have accessible to decrease your risk. Like as I mentioned before, throw rugs, as it becomes winter season, assessing the driveways, the sidewalks. What are you walking into? What is the slope of the driveway? Are they walking downhill? Are they walking uphill? Even just change in surface from grass to concrete. That is a big trouble for a lot of people if they have instability in their ankles walking around. So this checklist kind of goes through different ideas like that. Lighting is another area that you could screen for in the home with individuals. If people have poor vision, when we're getting up at night, we're a little bit disoriented with change in scenery. So that's something you could recommend or propose for people. Even in their toilets, they have little lights you can put in the toilet to kind of illuminate that space, night lights. So it's kind of an off topic from the home safety checklist, but more of a recommendation of how you can maximize safety in the home for that. A lot of people utilize step stools, and I always kind of cringe when people ask me about step stools because, they tend to say, oh, I don't need a railing or whatnot, but that's where people get into trouble because it's like a high surface and they're not holding on usually, and that's where accidents happen a lot. So I would always encourage, they have those step stools that have the little handle support, using that, but trying to maximize where they're moving. If this is their safe zone, moving things down to that height so they don't have to reach in the cupboard for the laundry detergent every time, or things in the back of the fridge that are on the higher surface. And sometimes as caregivers, you could ask, can I move those down for you? Can you put things at a level where it's attainable more frequently and easier for them? Because it's until they have an injury where they could reach fine before, and now all of a sudden they can't. So that's something that you could do to help them.
And I think, Sarah, that's a mindset too, because I'm thinking, we have a lot of people, it's like, well, the cereal's there because I've always had the cereal on the third shelf, you know what I mean? And I think that becomes sometimes a mindset of saying, why?
Exactly.
It doesn't have to be on the third shelf.
I mean,
it can be on
sometimes
the
even
second shelf.
in our own homes, we see things all the time and we don't think things are cluttered, or we have a new set of eyes coming into the home, and maybe I could clear this area. Maybe this is a little bit more cluttered than what it needs to be for my entryway where I'm walking, or do I really need this rug here? People like to accessorize with rugs and decor, but if rugs are moving and slipping, they have, grip textures you can apply underneath the rug. But even then, I would encourage people to remove those, because it's a corner. Even it just happened downstairs, someone tripped. It happens often, and even if you have the best tread in the world, it still comes loose.
Oh, yeah, and sometimes those throw rugs and scatter rugs are put on top of wall-to-wall carpeting.
Yeah.
They're decorative.
Yeah.
And they really look pretty, but while you're falling down, they may not look so good.
Sure. And like footwear is another thing that people don't sometimes pay mind to. They're going in their scuffs that have no back support. They're walking around, they're going outside the house and then they trip. It happens a lot. I've seen individuals come to me because they fell and broke their knee because they tripped on a shoelace that wasn't tied. The simple things of like head to toe, what can I do to maximize safety? Are my pants falling down? Are they loose? If they stand up and their pants go loose, then they trip because they're, trying to save themselves while their pants are falling down. So little things like that happen. But yeah, I would look at all those kind of things, and I wouldn't be, you can approach it in a way where you're just trying to be giving feedback of how you could maximize safety. Not that you want to change their whole scenario, but like, maybe we move this out of the entryway, things like that, Even just getting them dressed to go out. So rather than trying to like stand up, maybe they should sit down and put on their coat just to ensure your safety if they haven't been out for a while, things like that. And then you could work to encourage them. If people look unsteady, how could you make a referral to therapy? It's a very simple process. Any physician can refer someone to physical therapy for a need for falls or balance or things like that. And you are the eyes of the people out there. So if you see someone that you're concerned about and you feel like they could be benefiting from some intervention, sometimes it's helpful to bring that to their attention.
Sarah, do you often have programs for caregivers, spouses, children at your facility when you have clients that are coming out of the hospital or
So like
Holyoke Hospital?
in outpatient department lane, we don't have programs per se, but we treat each person that comes in the door as that. So when I'm treating a child, I'm educating the parent. When I'm treating a spouse, if they are in the office with their patient, I'm giving everyone that education. So it's really a case-by-case basis. When someone's discharged from the hospital, they have to have criteria from the therapy usually to, can they stand, can they walk, can they get out? They're not getting the training of, can I get in and out of the car? We would hope that would happen, but that sometimes does not happen. So having that extra support.
Now, does your group, does Holyoke Hospital or the CORE, do they do in-home physical therapy?
We do
OT?
not. So we are affiliated with Holyoke Medical Center, and we have the Holyoke Visiting Nurse Association that does that. So even like that's another first step. If you have a concern about falls in the home, you can get nursing in, and then once nursing is in, then they can make a referral for OT or PT and whatnot. But any of those things, any kind of therapy, sometimes people are homebound, they can't drive. They can qualify for inpatient, like in-home therapy where the therapist comes to their house. So I'm more of a setting where people come outside to see us, but definitely sometimes there's a bridge between people have knee surgery, they have home therapy, then they come to outpatient.
And it would just be so beneficial for them to be able to have, obviously, especially if they have a fall, they end up with a knee replacement. Now it's all unfamiliar territory, plus it's a little scary because it already happened.
Yes.
So they're nervous about leaving the home. So it would be wonderful to have that as a follow-up. This is how you're going to get out of the house and into a car before the volunteers arrive.
Definitely.
So that their family is working on that at a physical therapist.
Yep. It's part of, a lot of times people will come to therapy for prehab before having a knee or a hip surgically replaced just to get some familiarization with the strengthening exercises because they're all very similar after having recovery. So that's a big focus for us. We see a lot of people like in that boat. But each office is a little bit different. And when you're in the Holyoke office, they're up on the 4th floor of the hospital. So they don't have the time and ability to go down to the car with someone as I would in a small walk-in clinic, off-site. So it really is kind of dependent on the need of the patient, what we are able to offer in that setting.
Sure.
But if there's any concerns with that, you could definitely bring forth that to anybody. And, sometimes home therapy is not it's not a long stretch like outpatient could be potentially, but sometimes it's 1 or 2 visits, but then they could assess their bathtub. Do they have a shower bench? Do they have grab bars? And these are other things that you want to look at when you're in the home. And in the shower, is there non-skid tracking? Could we put little safety skids to make traction? What's the setup like for the toilet? Do they need a grab bar next to the toilet to get up? Could they benefit from a commode if they don't have good mobility? So lots of other areas that have to have simple things just to screen about.
Yeah, I think one of the things that you mentioned before, which I think is really important to the volunteers is, you're like a fresh set of eyes. So when you get in there, my first thing, sometimes I'll walk into somebody's house and I'll go, God, it's awfully dark in here, and it could be for a variety of reasons. Maybe they've got some kind of a vision issue and the glare of the, if they open the shades or whatever.
Could be many things.
But, that creates a fall risk because you can't see, and even as a volunteer, we don't want you falling. I mean, you're at risk as well. So, sometimes it's just, and sometimes people will say things to me like, really? Oh, you think it's dark in here? Because they're so used to it.
Right.
That's their, you know what I mean? So all of those things are really important for you to take note of. Pass along that information for Joyce, to Joyce if you feel like there's, it's a problem area. But I think that's really important, Sarah.
Even fire safety, you think about like the heaters are coming on now, things are cluttered, are people smokers? Is there any hope, God forbid, they have oxygen in their home,
Right.
Just open things that any kind of declutter that you can find.
Yeah, and to Tina's point, so when we do conduct an initial intake, we're going and we're looking for all of this information. And helping people to be able to fix their stairs or things like that, easy access, make it a safe environment for them and for our volunteers before they go in. But with almost 200 clients in the program and new clients on a regular basis, we're not necessarily going back and conducting intakes over and over and over. So, their kids could have come in, cleaned the house out, they come home from rehab, and then they go right back to putting everything back down. So when you go in and right? So it's like, you clean the kitchen and somebody comes in and makes a sandwich. It's all changed.
But those are the people that are homebound, the people that have food insecurity. You go into their fridge and there's nothing in there. You have the resources to help or to help connect them with resources. So those are things that we need to be mindful of. People don't want to say that they need help. People are private, but I mean, we see a lot of that when you are inpatient and in the home.
Sure.
All those things that people don't want to talk about become known. Is there foul smells? Is there concern for infections or different things in the home?
Right. A change in attitude, change in mobility, change in cognitive.
Yes.
So those are the kinds of things that we're really looking for too. Yes, it's wonderful that you're taking them out to the market, having a cup of tea with them,
It makes
or
all the
giving them
difference.
transportation to medical. But if you're seeing somebody on a regular basis and you see them and there's something going on, tell us.
Yeah.
Let us know immediately. You don't address it. You let us know.
If someone falls at home and they say, oh, no big deal, no big deal. That is a huge deal. People
Huge deal.
always downplay that in the clinic. Oh, I had fall. Well, that needs to be addressed because did they hit their head? Did they lose consciousness? Do they have a broken bone that's swollen? Pain with weight bearing, they can't wait.
After it happened, like, see, they tell me 2 weeks later. I'm
Yes.
not telling anybody. I don't want to tell
Yes, well, you need to tell
Right.
somebody because they need, maybe they're fine and you can hope that they are, but you don't know until they have medical evaluation completed.
And the other thing is, because I just did a thing on falls prevention yesterday for some of the seniors, is what was the underlying problem that caused the fall? Is
Right.
it a medication
Right,
issue? Is
yeah.
it, is it something, and said the same thing. It's like, make sure that you tell your medical provider that you fell so that we can figure out, you know, is it a blood pressure issue? Is it, you know, I mean, it could be one of a number of things.
But even then, if they had a fall, they don't tell someone, they could have a bleed, you know, and then something else, and then you're with them and something else happens. I mean, you have to treat it as,
Yeah.
you know, the worst case scenario, and people don't like that, but you have to.
Well, but you know, and we've had people fall here, and I know in the past, and it's like, oh, I'm fine, Tina, I'm fine, and then the next day, well, my wrist is really sure, and we, you know, they go
Yep.
and have an X-ray, and there's maybe a hairline fracture
Yep.
or whatever. So we don't take those things lightly,
Yep.
you know.
Well, so in situations like that, if you're going to a client's home and you see something like that, or they say, oh, I just had a fall, but I'm okay, or something, so what do we do?
I think that's a great question.
Call us right away.
Yeah.
Okay.
Immediately call
And
us.
just to make you
And you
aware.
can say to that client, I'm not comfortable taking you out of the house. I
Yeah.
think that you need to see your doctor, but we need to contact family, or I definitely need to call the senior center and let them know. Our clients know that when they become clients in the companion program, that there's an oversight. We ask them to talk to their family about the fact that they are in the program, and that we will be following up if we see something that's not working for them. So, you know, we're attentive to that. It's not your responsibility to do a diagnosis. It's totally
Right.
your comfort level. You let us know. I would 100% support that decision to leave.
Yeah.
I'm gonna call Joyce. I'm not gonna take you out today. I think you should rest and let your family know you've fallen.
Yeah, right,
Call us,
Yeah.
and we'll take it from there.
Fortunately, I've never had that kind
No,
of
but
situation, but.
and hopefully you
Right.
won't.
Even sickness, people sometimes, like, you know, they're in bed, they haven't gone out of bed in a couple days. Well, that is another red flag. They need to be,
Yes.
Right,
people
yeah.
need to be notified of that, because
Yeah.
the flu turns into serious things, you know, sickness,
Yeah.
dehydration, all these things. you
Yeah,
know?
I had a woman who was in the grocery store with a client, and the client fell. And of course, the manager of the store came, and 911 was called. She called me and she said, "What do I do?" And I said, "You go home. We'll take it from here."
Yep.
And so that's the reason you don't go out when we're not open. That's the reason we don't go out on holidays. We don't go out on weekends or nights. We only go out during the hours that we are open. And you immediately call front desk and identify yourself as a companion in the program. Don't get transferred to my voicemail.
Yeah.
Speak to a person.
Right.
Any questions with any of that type of?
How do you deal with someone
I
who just come back
remember the man who fell.
not wanting you to call, but or
Well, I think you have to circle back to saying, you know, I'm doing the best interest for yourself and for myself. I can't help you and take care of you if I'm in a scenario where I'm at risk, and if I feel like I cannot help you get up or stand because you're not moving well, that's ultimately safety concern for both of us.
Right.
It happens often. People come into the office and, you know, they've had a fall, and I'll call the primary or the doctor, and they really don't like it, but unfortunately you have to make your judgment call. You can never be too safe. And if you're having any hesitation or concern, then you need to listen to that. You know, ultimately they can be upset, but it's their safety and your safety that's on the line. So,
And I think in your case, you know, as a volunteer, all you have to do is call Joyce. You know, all you have to do is call the center. Joyce may or may not be here, but one of us will be here. And you know, the explanation to the client is, I'm a volunteer. I work for the Council on Aging. I need to report this to the Council on Aging. And as Joyce said, we'll take it from there, whether it's contacting family, the medical provider, you know, having our nurse weigh in
Yeah.
on it, you know, whatever
Yeah,
it is.
we can have a police officer go out there for a safety check. If you
Yeah.
go there and somebody's not answering a door, but you called them and confirmed that you're coming over, you're gonna call us. You're not just going to bang on the doors and open the windows and go in. If they're not responding, they could be on the floor in there. They could have also just forgotten. And we need to know that they've forgotten that they were being picked up when they were confirmed the night before. That's a red flag. So always, as a volunteer, your responsibility is to let us know. We're the ones that oversee all of our clients.
Yeah, and that takes the responsibility off of you.
Yep,
So you don't have to
100%.
have you don't have to get into it with the client and say, well, what happens after this? I don't know. I'm just gonna report to my supervisor at the COA. They'll take it from there. They'll be in touch with you, and then we'll fight it out with them.
there shouldn't be any tolerance for any kind of violence or altercations at all.
No.
You need to step back and say, I'm sorry, you know, I'm not, this is
Yeah,
not
we don't
appropriate at all.
Absolutely. If there's any kind of I had a client that was transporting, I had a volunteer who was transporting a client, and they got into a political debate that was not of the choice of the driver was definitely not the one who started the conversation. And I called the client out on it and said, you don't ever, as my mama said, no politics, no religion,
That's
and no
right.
COVID discussions, folks.
Did you see the flyer today?
Yeah. And I mean, if you can't, or again, if it's an aggressive behavior, it could be an underlying medical condition.
Kind of a problem.
So, the majority, I always say to my clients, treat the volunteers the way that you will want to be treated. These folks are doing you a service. This is a service, and it's a voluntary service. So they don't have to come back and pick you up.
That's right.
But even like altered mental status, you get there and they're not sure who they are, or something seems off. That's another eyes and ears. You're the first ones in there, in the home. And if you have people that have concerns for, they have a fall or they're a fall risk, they have little, you can have safety boxes installed outside of their home from the fire department that can come in, like a key box.
Yeah, we
And those
do
are
that.
sometimes helpful things people don't know exist. So you could bring forth that information to them and have that be installed.
So we do that in their intake process. We
That's
go
good.
through the Friends form. We do the lockbox. We do a fire
Yes,
safety.
lockbox program.
Yeah, that's all
Great.
part of our initial safety program. So we're pretty thorough.
That's good.
Again, when we do our initial intake, it's as time goes on,
Yeah.
that the needs change of the
Sure.
clients. And that's one of the things that we're really trying to work on too.
Even like life alarms or,
Get back
bracelets
and
or
all of that,
necklaces, all
working
that
with
stuff.
agencies, yeah.
Yeah.
Could you address, say, if a volunteer walks into the home and the senior's on the floor, what their response should be?
Sure.
Or if they fall when they're with them?
So first I'll address when they're on the floor, you walk into the scene. So you walk into the scene, you don't know how long they've been down, right? So first response is, hey, are you okay? Jostle them, shake them, are they awake? If not, you're immediately grabbing the phone and calling 911, right? Then you're assessing if they have a pulse. And hopefully you have CPR training or basic first aid training. And then, the EMS full services will guide you for the next steps. But God forbid that happens, That's why it's always helpful to have a cell phone too with you, because you could go in, you don't want to leave your phone in the car. You walk into this setting, you don't know what's going on.
Right.
That's your lifeline
is to help.
Them, but
the
you don't.
senior
Someone's
up,
down.
but
I
that's-
help them. You don't
Yeah.
want to help someone up from the floor if they've fallen. You don't want to
Right.
move them. You want to stabilize them. Just keep them. You don't want to give them any food or water either, because you never know if they're going to need surgery or something like that. But you want to just try to remain calm and stay with them. And if they're alert, just keep talking with them and
Yeah,
get
don't
EMS
put
on the
yourself
phone.
at risk
Get 'em a
trying to
blanket,
get them
'em a
up
pillow,
or
Yeah.
them.
911.
But even
Yeah.
a pillow, you don't want to move them.
Well, yeah.
Depends on,
Just something to kind of keep them
exactly. Keep
comfortable,
them, just
depending
keep
on
them talking
where
with
they
you,
are,
and
yeah. But at least, sometimes if they seem cold, you just say,
Yep.
can I throw your coat over or
Yeah,
whatever.
and just offer that
But
comfort. I'm
911.
here. We're going to get you help. I'm not going to
Yep.
move you until
Right.
somebody gets
Yeah.
here
Yep.
that can address your
And if you-
situation.
If you haven't had CPR training, the Holyoke Medical Center offers family and friends CPR once a month. It's a free service. You can go get basic CPR training, and it's a great resource. So,
That is.
I always share that information when it comes out. They have it often.
Okay. Yeah. If you could email that to me.
Yeah.
That would be great.
Yeah.
Yeah. So that we can put that out.
That'd be refreshing.
So that is, I think, just more of just you're not doing it. It's more for your own knowledge base and your comfort level. So some people feel better having that, but
Certified 4 years ago?
Yeah. It's
Yeah.
It's
Yep.
technically it's every 2 years. If
Yep.
you want to stay certified, it's every other year.
but that's another great thing to have. Peace of mind sometimes.
Yeah.
Because we all panic, but knowing how to stay calm in that situation is the biggest thing, because they're looking to you for security, and if you are all frazzled, that's not really going to help this scenario as much.
I had a client, a lady, a couple of months ago. I picked her up as scheduled, took her to East Hampton. She's
With
my
your
daughter.
car,
With my
not
car.
your arms.
No, my car. But she said, my daughter's gonna come pick me up. Wait a minute, something's not right here. I called the senior center and I said, I'm gonna wait here and watch for her to come out
Yeah.
and watch her get in the car. I just wasn't comfortable leaving her, especially that far away.
Yeah.
Leaving her in East Hampton. And the
Okay, have a
doctor.
good day.
Yeah.
Yeah, right? I
I mean,
know.
an
No,
hour,
that's
15 minutes to wait, but I parked her and watched the door. And when she came out, I just said, okay, I'm comfortable that she's with somebody she knows. She got right in the car. And then came home
Yeah.
and talked to Joyce about it and just said,
Because we're very clear with our clients that our volunteers don't drop you and drive away.
Yeah, it's not a taxi
It's
service.
one thing if you're having a colonoscopy, and again, that's why we're doing it during the hours that we're open.
Yeah.
If we've arranged for you to be dropped off for that colonoscopy or other procedure,
Yeah.
then we have a pickup time, or you have the phone number to contact them or me. So we don't drop people off, and we don't take any of our clients at what
Their
they're
word.
saying when I've
No.
told you something different.
That's right.
So yeah, that's a perfect example of she needed to. I had to call her and
Yeah.
say, so when we arrange transportation, you don't change it.
That's right.
You don't change it. We change it. If your
That's very
daughter's
good.
coming, that's phenomenal. We need to know that in advance.
Right.
I also had one where I always typically go in, even if they're mobile, I go into the doctor's office with them, at least to the receptionist. I had one lady in Springfield that I took her in, and she was on the wrong day, wrong doctor, wrong building. It was everything that Joyce had. It's just, I left her there, sat out in the parking lot forever because she was totally confused.
Yeah.
It's
Yeah.
common. I mean, people
It
get
is
confused
common.
very easily.
Yeah, the average
Second
age
set of
the-
ears, sometimes even if they're willing and they would maybe be appreciative to have that second person stay with them. Sometimes it's all case by case basis, but you can say, hey, do you want me to come with you? Do you want me to stay here? You know, I always have people come into the office when they have someone with them because it's going to help the patient have security. It's going to have second set of ears, hear everything.
Yeah.
You know, twice as many on the team.
Yeah, and for the clients that say, no, I'm good, I'm going to go into the market, you clearly say, I'm dropping you off here, this is where I'll pick you up. You come out and you stand right here, I'll be watching for you. So, you know, when they say, I'm going to go in here and you pick me up the opposite end, such and such, no, we're going to pick you up right here where we just dropped you off.
Yeah.
Joyce is very, very good at setting boundaries. and she's really good at setting boundaries, and that's what the volunteers need to do. You
Yeah.
need to set your boundaries.
Yeah, set boundaries.
And, you can do it politely.
Yeah.
No, we're not going to do it that way. We're going to do it my
We're gonna
way.
do it,
And
yeah.
some people can be very pushy with how they,
Sure they
you
can
have
be.
you have to have your
Yeah.
time because they don't.
Yeah, and
You
I'm
know?
very clear about that. When you do take somebody to a place that I've asked you to, we don't stop at 15 places on the way home after
no.
that. They need to be clear with me, and I know it's hard to say no. I know it's really hard to say no, but we're going to address it. You call me and say, hey, I just dropped such and such off, and she needed a few things. I'll call and explain the difference between a medical transportation and an errand trip. There's a big difference, and people, especially whether it's cognitive or whether it's new to the program, or simply they're a little more aggressive than we
said,
are.
just manipulation. We do have
It
that.
could be manipulation, and they certainly know some of the people who are easy targets. So that's another training.
I have stopped at the drugstore. when they came out
Yes.
with the
Yeah, yeah.
prescription.
And that's
How would you be
lovely
ready?
if
Okay.
you can,
Yeah.
but it's not something that we always accommodate. And you have space on your mileage reports, let me know. Left with a prescription, I stopped and picked it up. Because I will clarify with the client that that was really nice of that volunteer, but sometimes volunteers are caregivers for grandchildren and need to be home, caregivers for spouses or other family members, or have jobs, and they can't be counted on to do that. So that's, you were very fortunate that it worked out, but next time, let me know in advance.
Yeah, and I think sometimes the clients think, well, it's just an extra 10 minutes or so.
And-
And in some cases, that's fine. And in some
Sometimes
cases,
it's
it's
not.
not.
Yeah.
And some of our volunteers have they're juggling multiple clients on the same day.
Sure.
Not often, but it's like, well, I've got to drop you off because now I have to pick up Mrs. So-and-so for her lab work or whatever.
Right,
So,
yeah, absolutely.
set your boundaries, set your parameters. Does anybody have any other, questions for Sarah just regarding, safety tips, things you should be looking for in the home, or any, body mechanics or anything like that. I love the car cane.
The car
Yeah.
cane.
I'd never heard of it, and she said, oh, well, what about a car cane? I said, I've been doing this a long time, and I've been doing the medical equipment loan program a long time. I'd never heard of it. I'd never
Yeah.
seen it. I didn't know. So I said,
Yeah.
bring it.
I need to get one for my mother-in-law. Yeah.
It's very
'Cause
helpful.
It's really, yeah, right. Yeah, it's just very difficult. And I wish I had one for my mom or my sister who had Parkinson's.
Yeah.
Because it's, they do grab onto
Mhm.
you,
Yeah.
and while we're younger, we're not young.
Yeah.
And
But even if you are young, it doesn't.
Yeah, right.
It's not a good
So,
thing, right?
yeah, it's just a really good
It's a nice
tool.
tool. Yeah.
Yeah.
Nice alternative.
The only thing I
It's
would
easy
be,
to keep.
yeah, I'm sorry,
No, that's
mindful of is just if someone has a recent shoulder surgery or like
Yeah.
a limitation with
Oh,
weight
yeah,
bearing
sure.
through the shoulder,
Sure.
um,
Yeah, and you
But
need
yeah.
to know how to use it. And also, I do like the second option. If you're going into the water, you can break the window.
Well, again,
that's
it's
a
like-
reoccurring
I mean,
dream for me,
well,
or a nightmare.
it's terrible. It's terrible, but
No,
it's another,
100%. Yeah.
or God
But-
forbid you're in an accident or something. I don't know. It
Sure.
could break a window. It could help other things.
Yeah.
Also, who was the one with the trash bag? Was that you, Peggy?
Yeah.
That's a
Does
great
any-
tip. I've actually never heard
it
that
is a
before. That's great.
tip. I've
Yeah.
never heard of
That's a
that.
great
So if
tip.
anybody else has any tips that you learned from your clients
Yeah.
or their therapists or whatever, again, share that with Joyce, because most of you are on email now, so she can do an email blast
Yeah.
with, I just think getting that information out, I would have never thought of that, to be honest with you.
No.
But we all do that. If you've been in that situation where you're working with clients or family members, and you sometimes you just figure it out on your own and go, well, this makes it a whole lot, or they'll figure it out and tell you.
Exactly.
Yeah.
Share it so we can share it with the other volunteers.
Yeah, and also we do have a lending medical device.
We do,
So we
right.
have rollators, we have transfer chairs. We don't do wheelchairs,
No.
just clearly. But sometimes when you have somebody who has limited mobility, they're able to get in and out of their house. But when they get to a doctor's office or a hospital, there are wheelchairs in there. We would not put a wheelchair into a car because we don't want to pick up a wheelchair. So anytime you go to a client's house and they're in a wheelchair, you call us, okay? Because that's a real change. But we do have what's called transfer chairs. And even just in your personal life, if somebody's going to the Big E or going to the mall or something
Graduation,
like that,
wedding.
any of those type events, concerts, it is nice to have a transfer chair. They're very light. But we do have walkers, we do have canes, we do have things that can help folks to stay mobile. And I do try to tell all of you when I have a client that has a walker, because I want to make sure that you're comfortably putting those into the cars.
I mean, they can be
yourselves.
heavy. Some of those rollator
Some
walkers,
of
they
them
can be
can be
clunky
very
and
heavy.
big.
The rollators are.
They're all a little
lot of
different.
People don't know how to use them correctly, because you have to remember on a rollator walker, those are the kinds with the seat. They've got 4 wheels, and sometimes those walkers get away.
They
from
get away.
people, if they're not. Yeah, a regular wheeled walker with just the 2 front wheels is much slower moving. So the person using it can control it better. I'm always hesitant, because people, when they ask for a rollator walker to borrow one, they'll say, I want the kind with the seat so I can
Well, they always
rest."
want to say that, and that's a super
Yeah.
red flag.
Yeah, exactly.
And if
Most
if
of them have a brake on them.
They do.
Yeah.
they
but if
do.
you're
You
not
have to
locking
lock
them, or if you
have
don't
to
have the
lock,
cognitive capacity to do it safely or make sure you're sitting on it
Correct,
safely,
right.
So if you see someone and they're using something like that and it's getting away from them, that's another resource to say, hey, maybe they need a referral or an evaluation for the right assisted device, because their father or grandmother could have it in the basement. Oh, this is my grandmother's walker and I'm going to
That's
use
exactly
it,
what happens.
and then
Yeah.
That's
all the
exactly
time.
what- It happens all the time. And the other thing is even if it's the right piece of equipment, it might not be fitted to them.
exactly
Always
the right
get the
height.
input of like a physical therapist or an occupational therapist to say, what's a good height for this? What's a good width?
Things change. I mean, it could be at one
houses are
time good and
different.
no longer.
So sometimes doorways, I always have people measuring doorways. How big is this? Because sometimes you'll be out there and you'll see them using the walker, they're using it, but the door frame is too small. Now they have to turn sideways to get, in and out of the bedroom.
Yeah.
Because the walker doesn't fit. Well, walkers come in different sizes, so we can do that. But again, you're the eyes and ears. You're the.
If it doesn't look right, it usually isn't. So.
Yeah.
You know.
Like that.
That's
It doesn't look right.
Really great way to wrap it up.
Yeah,
It doesn't
exactly.
look right.
It probably
Don't
is.
do it.
What do you do with the customer, the old lady, she doesn't want me to bring her groceries in and help her. Just put her on the porch and she takes them. And she's super tired by the time we're done shopping.
So I
So
would.
how do I convince her that I should come in with you and at least bring them on the kitchen counter anyway?
What I would do is I would just try to get them in, maybe, offer them a drink or something. It would make me, I would put it back on myself. I would say, make me feel better about getting you settled in the house.
Yes.
This is a big trip. Just kind of reiterate, and you can kind of put it on you and say, it makes me feel better, not how you're feeling. I want to help you. This is my job as a volunteer to ensure that everything is settled and it needs to be.
Yeah.
Let's put things away. I think another thing when you're coming in and out of the home, people are always in a rush. They're nervous. I have to be at the appointment at 11. It's 10:45. Blah blah blah.
Yeah.
Talking about the plan of getting. Maybe they have things they need to bring. You bringing that in the car first, or telling them what the plan will be. We have this much time.
Yeah.
I think talking it out is a huge thing. Even the stairs. Which foot are you going to go first with?
Some people just don't want you going in their house.
Some people don't.
Right.
That's what it
Yeah.
seems like. Yeah.
Yeah, and that's a red flag too.
Yeah.
Because there could be an issue in that home
Sure.
when I do the intake, they either let me in their house or they're not in the program.
Did you go into her house?
I go into everybody's
Everybody.
house.
Yes. You don't
Yeah,
have to talk
or I
first.
don't put them in the program.
Oh, okay.
Yeah, they need to let me
That
in
makes sense, yeah.
or they don't go out.
Some people, I think, feel bad that you're taking up too much of your time.
Yeah,
They don't want to,
Yeah.
But you can just put it back on you and say, hey, this is no big deal. I want to help you.
Yeah.
It takes 2 seconds.
'Cause you're so
We can make sure
exhausted,
everything is
it's so
accessible.
bad.
Yeah.
Yeah.
It's hard.
My client is definitely that way.
Yeah, and there's a real transition period. So I mean, like with you, this is a client that just stopped driving. So it's a
It's a
real
big thing.
transition period, and that's a great point for me to know because
Yes.
I need to
Yeah.
follow up with
I
her
know,
and
I
say
know.
how is it going, and
And shop for her sister too, so we do 2 shopping.
so yeah,
She's-
so she
I
has
can't- she's
a big sister.
I can't
Yeah.
do this anymore. She's really getting tired of it.
Yeah.
It's really, both of
Well,
us. I was
of course
exhausted
it
too.
is. Well,
It's
yeah.
really tiring.
Yeah,
But-
it's a unique situation where
Yeah,
we have a
very unique.
90-year-old woman with an older sister who lives right around the corner. I know her big sister is very tough,
Yeah.
and
deaf.
she's
Totally
and she's
deaf.
compelled to do all of her sister's grocery shopping
Yeah.
for her because her sister resuses a
Yeah,
companion.
that's a big
So
list.
it's a situation.
But then you
that
get caregiver burnout too, which
We're-
again, you're being aware of,
Yeah.
And you don't want to have that happen to yourself either.
Yeah,
You have to,
right,
knowing when to
exactly.
pass the buck is okay.
Yeah.
Yeah, right here.
And I think too, Joyce was mentioning somebody had recently lost, stopped driving or whatever. I think that people, all of us, including our clients, want to maintain as much control over their
True.
lives as
Yeah.
possible. So sometimes it's a matter of exchanging that control. So, I'm going to bring the groceries in. You're going to decide where they go. You put them
Right,
away. That's
exactly.
your
That's-
responsibility.
yeah,
Right.
could be
And I would word it that way. Okay,
Yes.
that's your my responsibility. My job as the companion program volunteer is to get them in the house safely for you.
Right,
Your
right.
job is to figure out the rest. I'm
Yeah.
not the, I'm
Yeah.
not
Yeah.
going there. And put
I
that
think
back
much
on
better
them.
if you let me do that. I'm
Yeah.
gonna,
Yeah.
We had a family
Yeah.
friend
yeah,
that
I'm gonna.
similar way. We'd bring her groceries in for her, but
Yeah.
she wanted to put it away. But if you put it way in front of the cabinet where
Right.
it's going to go,
Right.
then she knows
That's
that
what I'm
it got
saying.
into the house. 'Cause she has her list. She wants to
That's what I mean.
cross check,
Yeah.
right? But
and
it's still like
having
there.
it up on the where they can.
Right.
You don't want them bending down and trying to pick up those big bags.
Yes.
And yeah,
or even laundry in the basement. That's like another big red flag.
that's-
you know,
yeah, that's
if
something
someone
we
is
talk
stubborn and they
about.
want to do laundry, I mean, not that I would ever really propose that, but if
no.
when
we don't
someone's
do that.
there with them, to go down that staircase and back up that staircase because that's
Oh,
an
No, that's
accident waiting to
something that
happen.
We also include in our intake for
Yeah.
Highland Valley Elder Services. We do referral services, so we would never.
Rock, salt, sand, those are other things to have thinking about as winter comes.
Yeah.
you know.
Yeah.
But even that can be
Senior
slippery itself too.
program.
It just,
Right.
you know,
Right.
tread on the shoes.
Exactly.
Are their soles intact? Do they have old shoes? I mean, the things you see sometimes, people come in with broken shoes, and
Yeah.
I mean, it's out there.
Yep, footwear is important.
Yeah, and I mean, also, one of the things that we definitely do when we're working with clients is make sure that they understand that this is empowering. It's not taking away. We're not taking away any power from you. We're giving you the power to age at home because you're accepting services.
Yes.
So if you want to age in place, by getting these services in, your kids are going to be like, Mom's okay. Mom's got groceries. Mom's going to the doctor's appointments. Mom's okay. We're going to get off her back about moving, or at least slow the process down so we can get her to accept it. The more services they accept, the easier it is for them to accept even more.
Yeah.
Because once they open that door, and you're often the very first volunteers service that they have, and it's the segue for more. For example, your client accepted medical transportation very reluctantly, and then all of a sudden having somebody to take them to the grocery store as opposed to relying on their nephew
Yeah.
made more sense
Yes.
because
Yeah.
Well, it's a
it
trust
does.
thing. They don't know you. You're a stranger.
For them.
Yeah.
Yeah.
Right.
Yeah, and so we're going to get her to let you bring those groceries into the
That's the
kitchen
next
counter.
step,
It's the next step, and that's the process of helping these seniors stay in place, and someday hopefully having someone do that for us. Long time from now.
Yeah.
Yeah, but you know what, sometimes that I have to think to myself, and I think all of us as, you know, kind of care providers and volunteers, it's like, well, what would I be like in that situation? And I know I'd be the one
I'd
to
be
say,
fighting back
"Leave
the whole
those
way."
groceries right there, I'll take care of it, you know,
Exactly.
so
Yeah.
and sometimes it's helpful to just share that with the client and say, listen, if I were in your, I know I'm gonna be doing the same thing,
Yeah.
but, you know, you can always put it back on us. I always used to say when I
Yeah.
was director here, it's like, sorry, but I answer to the mayor, so we gotta do it this way.
Yeah.
You can say, listen, I answer to the big cheese at the COA, so, you know,
Exactly.
sorry, but
Yeah.
Joyce is making me.
Yeah.
And I
Joyce
always
is
used
making
to
me.
say to
Told
the-
me, yeah.
Yep, and I always used to say to the staff, throw me under the bus.
Yeah.
Because you're the ones that are working one-on-one.
Yeah.
So we're kind of the people behind the scenes.
Yes.
It's okay
Yeah.
to say, you know what, I'm gonna get in trouble if I don't, I'm gonna get in trouble with
Exactly.
Joyce
Yeah.
and her supervisor
Yeah.
if you don't let me do this. So
Yeah.
let me do this and then you handle the rest and I won't say anything to the supervisor about you put your own stuff away, you know? Something, use a little psychology.
Yeah.
You know, just use a little psychology.
Yeah,
Yeah.
absolutely. And to that point, I recently had a woman who was going out very new to the program, and she was buying all of her groceries on the very first trip, and there was like $400 worth of canned goods and all that stuff. And my volunteer called, and I said, "Oh no, we're not doing that. We are not doing that. We're not carrying anyone, you know, huge jugs of water
Yes.
or, you know, 10 bags of
Oh
canned
my,
goods.
yeah.
No, there's, you know, it's especially when they're just one person. So that's an instance of like maybe over purchasing. We need to know that
Yeah.
because we don't want them eating cans that are 25 years old.
Yeah.
Oh,
So
my.
what's going on? Again, getting in that house.
And on the flip side, it could be
Lots of
they don't want to be the burden to have to go out again. I know I have a person on this day, you know, we all know someone that's like that wants to plan ahead and, you know,
Yeah.
it's anxiety provoking of like, I got to get this done,
Right.
you know.
Yeah.
I think you're right, Sarah. I think a lot of times people are like, I don't want to waste your time.
I want to
You
get
know,
this
yeah.
done. I know I have a person on this day, you know, even
Makes
accepting
sense.
help is such a huge step. Even, you know,
Huge
transitioning to using any kind of device or not driving, that's
Yeah.
it's a huge thing to overcome.
I'm working on it.
And I just remember, I would say
Tell you
sort of
what it
as a wrap up to our piece of it, you know, some of the programs that Sarah mentioned, you mentioned SAND and you mentioned the lock boxes. Those are all programs that we actually do through the Retire the Fire program here. So you all might not be aware of some of the other programs and services that we have access to through grant writing and so forth, but Joyce knows. So again, it always goes back to your coordinator. You know, you're the eyes and ears. Let Joyce know. Because as she said, she'll go out and do that initial assessment, and she's telling me on her initial assessment, you know, so-and-so needs a residential lockbox, and I've got them on a list, because I have a wait list for those, but we have those on the list. But as Joyce said, you know, 2 years later,
Right.
3 years later,
6 months later, things have changed, and somebody who maybe was more independent is less independent and now could benefit from some of those programs and services. So you're the ones that are gonna let her know, and then
Right.
she's gonna come to myself or Mike or whoever, here to say, we have an issue, what can we do? And sometimes we can work magic, and I think of the stairs
Yeah.
that we had put in
Yeah.
through a grant that I had written with the fire department. We were able to get some people, one of the clients, a new set of outside stairs.
Oh, that's
They were
wonderful.
so
Great.
unsafe that the volunteers
Wow.
we couldn't get a
I
volunteer in
wouldn't,
there.
I wouldn't let a
Oh,
volunteer in
volunteer
there.
in there.
Yeah.
And it was during COVID, and I had some money through my Senior Safe program that we hadn't spent the way we wanted to because of COVID.
COVID, yeah.
And so I got special permission from the state, and it was a long shot, because I thought, I can't imagine they're gonna let me do it.
You gotta aim
They
high
did.
though, why not,
They let
right?
me did it, they let me do it,
And it changed her life.
And it changed her life.
That's
It
awesome.
changed her
She was
life.
able to
Oh,
get in and
yeah.
out,
Oh,
yeah.
volunteer.
Yeah,
That's so nice.
she's still in her
It's a
family
pretty
home.
cool story.
Yeah.
Yeah, it's
So
a really
we
great.
took some
It's a
before and
good.
after, and it was only a couple of steps. It was
Yeah.
just out,
Yeah.
from the
Yeah.
the
But it
kitchen
made
or
all the
whatever
difference.
outside.
Yeah.
But it made all the difference
Yeah.
in the world.
And
So
it's secure. And
Yeah.
she's up and down, and she's got a little.
railings
Yeah,
and sturdy
yeah.
wooden
It
steps.
changed her life.
Yeah.
She's a completely different person.
Oh, yeah.
Thank you.
That's wonderful. Fewer phone calls to us.
That's right.
Think, honestly, it's like when people are insecure, we're getting a lot of phone calls. But if we can tighten that up,
That's
okay,
right.
I'm good to go now, which,
Yeah.
can
How
really-
great for all of you to be part of this program, to
It
like
is,
give your time to
right?
do that. That's
It
so
is.
amazing,
It's pretty
you know?
It
amazing.
is.
It
is.
You're pretty amazing.
They
all
are
of you.
our volunteers are phenomenal. I call them my volunteers.
I'd love to get some information from you because, like, so the office I work inside of is inside a building of primary care. So my therapy room, it's like a tiny little room in the middle of all these offices, right? So I hear all these things all the time of different people. Oh, I can't get a medical appointment. The Council on Aging refer to Westfield. You give them the number, right? Would that be the best recommendation you would propose? Just giving them the number and then,
Yeah, residents
You know, I mean-
of Westfield, and then we'll do
Yeah.
an intake service. I work with Holyoke VNA on a regular basis. I'm working with a client right now.
yeah.
That I met Laura over there at the house yesterday. We spent a long time with him. So it's about,
Yeah.
it's more than this, but it starts with this.
Yeah, and what, Sarah,
Um,
too, if we can't help them here, if it's something that's beyond the scope of what we
Right.
do here, we have some pretty good referral sources that we can say, well, we don't do this directly, but we're gonna give you 3 numbers or.
And sometimes it's so hard for people, I think, to even pick up the phone. So, like, I will make the effort to call when they're with me because let's call them right now so we can know what's going on. People, that I think is super helpful because,
We've had practitioners
You
come
know.
on and.
Oh, yeah.
That
I
works.
I will hunt the people until they call Highland Valley Elder Services because I want to know that it's in place. Get an assessment.
yeah.
It's your gateway. So, yeah.
And Joanne is our
first
outreach
step.
worker, so
Yes.
she handles, a lot of our.
For just people that don't, like, I was in the office yesterday and I had them call because this person didn't have a way to get to the appointment.
Yeah.
And it was like, they don't qualify for,
Commonwealth Care. And
yeah, none of that,
Yeah.
but just, yeah.
And they can't use Dial-A-Ride, the PVTA senior shuttle.
Yeah, just I don't think even having the knowledge base, like even
Yes.
the medical assistants, this
Yes.
exists. You need to use this number,
Yes. Yeah. We've talked
So
about
that could be, I think, a helpful thing even just for your people to know, like even other offices. Like a lot of people don't know what's out there. Seniors don't know sometimes. I mean, some do, some don't. But
We are
publishing
the-
that,
when we go into people's homes and we talk, and it's always, it begins with that first intake, and then it gets sent out for referrals to Shine coordinators, the RN, to Joanne.
Yeah.
And people are always like, I just thought that the senior center did knitting.
Right,
exactly.
And it's
Yeah.
like,
Bingo.
my own sister, when I took the position here, said to me, "What are you going to be doing, crafts?" And I said, "I don't think so, but I'd love to." But yeah, that sounds fun, but it's so much more than that. And we really are a referral network for resources for our seniors. That's our first and foremost. We're not a service per se, we are a service referral. So we work really hard to get all those services in place.
But our craft groups are wonderful.
Yes, and the quilting groups, and
Yeah,
all of that, absolutely.
Well, even like the exercise classes. Like I hear so many people, oh, the
Yeah.
classes are so great. So I wanted to kind of get more information from you as to what it is because I'm the bridge. you're doing your home program, but maybe that stepping out will get you in that social aspect of recovery, which is so helpful too, But people getting their foot in the door is that biggest step. Like
Yeah.
they're
It sure
afraid,
is.
they're nervous, I don't know,
Yeah.
But you are also welcoming, so,
Yeah.
hopefully.
And I would say too that every group that meets here, and I've said this all along, we have some formal support groups, but every group that meets here, whether it's the quilters, the stitchers, this exercise class, that exercise class,
Yeah.
they form their own support group. The art
Yeah.
class, I mean,
Exactly.
the bridge player, they are their own formal. And the one that cracks me, the pool players, I can't tell you how many, because they're mostly men, 99% are men, but I can't tell you the number of times, one of them would show up in my office with the door closed. Tina, how's so-and-so? So-and-so hasn't been, hasn't
Well, yeah,
been
they check
here
on each
in
other.
2 weeks. And then 10 minutes later, somebody else will come in, Tina, you don't know this, but so-and-so hasn't been here in 2 weeks. And then,
Yeah.
one day I had 3 of them come down, like 15 minutes apart, not knowing anybody else did,
Yes,
thinking they were
yes.
the only one.
Yeah.
But that is really important, Sarah. And I think your observation of get your foot in the door with anything, whatever the program or service is, and then oftentimes that can really kind of blossom.
You got to sell it almost like you're selling, cell therapy, you're going to sell
Yeah.
the senior center,
Yeah.
you're going to sell,
Yeah.
because once they go, they love it,
Yeah.
And
Well,
isolation is not good.
No, it
No.
isn't. It
No.
absolutely
It's
isn't,
very
and that's that's part of what the volunteers are doing is to really try to prevent that. So,
All right.
Sarah, I want to thank you so much for your
Yeah.
expertise and being willing to do. This was a really different kind of a training because I said to her, well, we're going to start in the parking lot and then
Well,
move inside.
I was honored to get the email. So I'm the supervisor in Westfield office. So
Okay.
when they emailed me, I'm like, well, of course, you know what? I'm definitely not a public speaker. I'm more of a one-on-one kind of gal.
That's okay.
And I figured, well, we have these handouts to reference. So I hope I was able to address your questions in a way that was like not too,
It was
off the.
very helpful. Thank you
So,
very
yeah.
much.
Yeah.
And really helpful having you actually do the demonstration.
Yeah.
there. I think
But again, that's such a limited thing because when they first asked, I'm like, oh, it's so hard to say because people have different needs, right? But I think the
Yes,
biggest thing, even standing,
Yeah.
and I go through this, I feel like all the time at the office, but people are sitting in a chair and like, I can't get up from sitting.
Yeah.
I'm sitting too long,
Oh, that's a big problem.
So scooting and weight shifting
Yeah.
or just moving your legs, even if, if someone has Parkinson's, they've been stiff, the tremors, whatnot. Try to avoid staying in one position too long. If people are sitting, you go in every time they're on the couch watching TV, encouraging movement, walking,
Yeah.
all those things help.
Yeah,
And
absolutely. Yeah, get up and move around.
Yeah.
During commercial breaks, even if you don't have to go to the bathroom or get a snack, but just
Yes,
get up. Walk
Yeah.
around the coffee table a time or two.
Yeah.
Seriously.
even just a sit to stand from the kitchen table, they got the kitchen table right in front of them. This is one I give out often because it's safe. Usually,
Yes.
you got the chair, you're pushing ideally from the arms of the chair,
Gosh, yeah.
and then you got the table to balance yourself, and then you come up and down. You start with 5. You do 5 a day.
Yeah.
And it builds.
Yeah. And we also utilize Channel 15 a lot. So we have, which is our local cable channel, we have exercise programs on, this is good for you to know too, we have exercise programs on Channel 15 that we started doing this during COVID.
Okay.
Every day of the week. So 7 days of the week, we have different, we have line dancing, we have male call, we have chair yoga, we have regular yoga, we have dance yoga, we have Zumba. And I was just talking to Sue Graney, who is one of the tax volunteers. She said to me, I still do the program. My husband is a chiropractor and my daughter did 3 exercise programs. She said, I still do that. It's aired whatever days they're on. She said, I still do it twice a week.
That's awesome.
There's my TV, and because during COVID, we said to all of the instructors, if you're going to use weights or whatever, these people nothing was open.
Yep.
So whether it was using soup cans, or I said you have
Yeah.
to come up with exercises that they can do in their home.
You have to be
with the things that
creative.
they
Yep.
have.
Yeah.
Right. We're still airing those. So we
Yeah.
started with just a couple times a week, but now it's, we have at least one. Some days we have 2 or 3. So people, there are different times. The schedule's in our newsletter.
Awesome.
So,
And you did a nice
channel.
flyer that shows all the programs that you've actually filmed
Yeah,
that are
I did it.
accessible through the
I did a
website.
I'd love to get a copy of that just to have.
I did a
because
flyer on the
share that.
educational programs that we did.
Okay,
Yeah.
awesome.
And we just had Dr. Pavlov from
Oh, really?
Live Medical Center. He did one on pulmonary
Yeah,
conditions.
with Natalie.
He
Yeah.
did the one, so we do a different educational program every month. We air that twice a week, and that's bundled on YouTube, so people have access to that. Yeah, he did a fabulous job. I mean, I thought I knew a lot, but it was a really good session. And those
Awesome.
are about
Great.
45 minutes to an hour. So
Yeah.
yeah. So we may have to get Sarah onto one of those
Oh, boy.
Council on Aging Present series to do. Well, some of them are sit and talk, but we have done some that are a little bit more.
Yeah, no, I would totally be open to that.
Yeah.
And the radio show, right?
And the radio show, yeah, I do a weekly cable and radio show, and it's on health. It's all focused
Oh,
on
that's
health
cool.
and wellness. So, yeah,
Right.
all good stuff.
Very good.
Thank you so very
Yeah,
much.
thank you.
Sarah.
Again, I left some other brochures and I left a couple business cards with my number.
Perfect.
Yeah.
in it, but
that's
anytime
great.
you guys ever need anything, you know where to find me.
Thank you.
Okay.
Thank you.
Thank
Thanks,
you.
Sarah. Thanks all the volunteers for coming.
Yeah, thank you so much for coming. I will be taking care of them. I know. Jeez.
And back on that, I took in Carrie and we both